the public option, whether we have it or we don't have it, is not the entirety of health care reform. This is just one sliver of it, one aspect of it.
Welcome back to Hardball. That was President Obama on Saturday, just a few days ago, talking about the public option. Well, is it dead? Meaning, will there be a government option, a government alternative to private insurance for some people in this country? Democratic Congressman Anthony Weiner is from New York. He's been around for a while, and he's a powerful member of the House Powerful Energy and Commerce Committee. Sir, I watched you on Today's Show. No, I think it was on Morning Joe this morning. You were good.
Thank you.
Let me ask you this question. You're for single payer.
I am.
You believe that the government should run basically Medicare for everybody?
Not run, but we should be the ones to pay for it. Still, doctors should run their own shops, hospitals should run their own.
Right, but the government should run Medicare for everybody.
But shouldn't give money to insurance companies to pay for it. We should let Medicare, a program like Medicare, reimburse doctors and hospitals. Right?
You were pretty tough with my colleague Joe Scarborough this morning saying, okay, what do insurance companies actually do? Was that a rhetorical device, or do you really wonder what they do
I wonder
to make a living?
No, what the value added that they bring. Like what it is that they're adding to the transaction.
Coca makes cars. Steven Spielberg makes movies. What do insurance companies make? What is their product? Is it just, are they track touts?
No, insurance companies
basically bed for people not to have broken arms?
In a commodity sense of the word, like automobiles, for example, you can choose what car you drive, where you drive it.
Right.
They apportion risk. That's not happening in the insurance industry. In the health insurance, you're not shopping around when you need an operation. You don't have the ability to say, I'm going to not get asthma if you're born with asthma. Right. It's not a commodity. So the insurance model doesn't work in the traditional sense like of car or house.
Okay, why do you think people, you know this country all across the country, even though you're from the East Coast, I'm from the East Coast, why do you think people in the heartland are suspicious of a government-run health care financing plan rather than something that has a brand name on it? They seem more comfortable with a corporate brand name.
Because they have been successfully, I think people have confused the notion of liking your doctor or hospital and liking your insurance company. I don't think people, despite what the president says, actually likes their insurance company. They like their doctor and are concerned that relationship is going to get broken. If you sit in a town hall meeting, as I did a bunch of them, you have senior citizens sitting, nodding in agreement when they say Medicare works. And you have younger people.
It's a great deal.
You have younger people who are saying, well, they don't get it. But try this test out. Take someone who's 50 years old or 55 years old and say, hey, you're going to get Medicare next year. They're going to be very happy.
Oh, I agree with you.
So people who understand Medicare are not as suspicious as, and that's 40% of the American people.
You're a politician. You deal with people, constituents all the time. And I remember working on the Hill. You get a lot of casework you have to deal with. People with particular problems with the government. They don't get a disability claim they want to get. You know, you've been through them all on Social Security. Why is it that some people in the political middle are less fearful of some corporate person, middle-level person, like in Sicko, the movie, Michael Moore, saying no to you on a claim, but they're more worried about a government official saying no to them. They can't get the transplant. They can't get the MRI.
100%.
Why are they more afraid of the government?
It depends entirely what lens of your experience you're looking through. You know, we deal with hundreds and hundreds of cases where we have people have problems with their health insurance. Very rarely do we have problems with people who have problems with Medicare. So, you know, people pay into their health insurance and they're concerned they're going to lose their coverage. Well, that's an unfounded fear. People who know someone in their family that has Medicare buy the Weiner argument that we should make this simpler and just extend Medicare to more and more people.
If we can afford it.
Well, look, healthcare inflation is a huge problem. But you admitted this morning we have a financing problem with Medicare. 100%, and we have it in healthcare.
If we have the whole country of Medicare, it'll really be
Well, hold on a second. The health financing problem with Medicare is actually there's less growth in Medicare spending than there is in the private insurance side. You know, and fewer people are losing their health insurance on Medicare, meaning nobody.
Yeah, but the taxpayer gets hit with it.
Yeah, but no, hold on. The taxpayer's getting hit anyway, and this is the thing that I think the president's done a bad job with. The uninsured, I care about them as an academic matter, but I really care about them because my constituents are paying for their health care through hospital emergency rooms. If the president would get up and say, you know what, you don't like paying that bill either, I don't want to either, we want to make sure that we do it in a more sane way.
We're paying for it anyway. A person has a right to go to an ER, a hospital has a requirement to take care of people that come in. But if we're already paying for all this health care for the 40-some million people who are uninsured right now, then why does it cost an extra $1 trillion to do it officially?
Because it doesn't cost an extra $1 trillion. We're taking money. I pay $3 billion extra.
But that's the issue with the budget.
No. But people are looking at it all wrong. I pay $3 billion extra taxes in New York City because now New York City residents are getting stuck with this. Now we're going to say, let's do this smart and do this with the federal government or do it with a co-op or do it with something else. We are the overall cost. If the overall cost doesn't go down, we failed.
So you think you're giving relief to the localities at all?
We are going to wind up. We pay $2.5 trillion for health care. If we don't pay $2 trillion in 5 years from now, this whole process is a failure.
Congressman, it's a week before Halloween. You got to vote on the floor. You got to vote on a bill. It's coming out of conference. It doesn't have the public option. Will you vote for it?
I don't know. Probably not. I mean, because if it doesn't
suppose
control,
your vote counts.
If it doesn't control,
suppose your vote is decisive.
But the math is meaningful to me. If indeed it turns out it doesn't save us any money, it keeps this cost going up and up, my citizens are not going to get any relief. The answer is a no, and I think, frankly, a co-op plan won't do it.
Suppose it's got 4 elements in it. It's got individual mandate. Everybody's got to join. It's got subsidies for people who are working people. It's got some kind of encouragement to business to insure people, and it's got something to do with reform in terms of pre-existing conditions and portability.
And
will you vote for a bill like that?
No cost containment, so the costs keep going up and it bankrupts our government. I can't vote for that.
Okay, let me ask you this. Is there any way to get a bill passed the Congress except with 60 votes in the Senate and 218 in the House?
Yeah, I think we can do it with 51 in the Senate under reconciliation.
But you've never... You would be willing to blow up the Senate rules and basically push it through that?
Blow up the Senate rules. Look, there's a reason that there's a Democratic House, a Democratic Senate, Democratic presidency. That middle block of Americans want us to get this done.
What do you think the Republican reaction would be if you ignored the rules and pushed through a bill?
You know, honestly, waiting for Republican senators to be pleased with this process is something I'm not prepared to wait for.
When the war begins, look, we've been through wars in this country. They're easy to start. It's easy. It's tough to end them. How do you stop a war that starts in the United States Senate right now because you jammed through a bill with less than 60 votes?
What do you mean jammed? Started a war? What are you talking about?
What are the 40 Republicans going to do? What are they going to do?
Outside of this town, the American people really don't care about whether Chuck Grassley voted for it.
Will the government still function if you try to jam this through with 51 votes?
I think it will.
You think the Republicans will put up with it?
Look, I think that people are going to be upset if it works. Then everyone's going to be embracing it. I know that people aren't watching till the government shuts down. I'm saying structurally.
Okay. So you basically believe the Republicans will take it on the chin?
There was a lot of very hot language around the Medicare reform. Whether or not, I understand the idea the Senate's going to be the cooling sauce of our democracy, and I'm in the House. I get it. I get it.
You're fighting against straw man.
I do not buy. Okay. No, but I don't buy the idea that we have to build this reform on the foundation of Enzi and Grassley. Snow. That is not getting us anywhere. The problem with what's going on at the White House right now is they're negotiating against themselves. They're not going to get the votes of these guys.
So you basically disagree with the president. His strategy seems to be try to get some Republican support. Ted Kennedy probably can't make the vote. You're going to need 60. That's their strategy. You don't like that.
I don't believe it's going to be successful. I just don't believe
they won't get to 60.
I believe they're not going to get to 60 anything really worth all that much. And it's certainly not going to be what he's been going out and articulating we've all been fighting for, which is control costs, get some choice.
Have you talked to Rahm Emanuel about this?
I don't think he's taking my calls right now.
I think he disagrees with you. I think he believes something's better than nothing, and you disagree with that.
No. First of all, in the abstract, something better than nothing, I generally would go for the something. But remember, cost containment is such an important part of this. We are bankrupting ourselves,
and you believe the public
economy.
Option is the key to cost containment?
I believe that, frankly, single payer is the real way you do it. But I don't even think public option gets you all the way there, but at least gets you started.
But it is essential.
And I don't believe the co-ops do it.
You believe it's essential to cost containment?
I believe that there's nothing else in the bill that would do.
So you see an Armageddon struggle over this in the fall? I mean, a real struggle.
Armageddon struggle.
Meaning like the liberals are going to say no way.
Here's what I think happens. I think that the president realizes at some point here a switch goes off. And they say, you know what? Why don't we push for what we actually think is going to be the best possible policy and try to sell it to that middle that elected us?
Okay, let me ask you 2 liberal questions, right? Should health care reform, the new bill that comes through, should it cover abortion? Should it cover abortion as part of this plan?
I am uncomfortable with the idea that someone who is less well-to-do should have less option.
No, but this covers like 4 times the poverty level.
This is a weird one. What goes on in the bill right now, and I heard your discussion with Chuck. What goes on is it kind of preserves the status quo, which is weird. Which is a health plan can offer it if they want, so long as they figure out a way not to have federal dollars come in. My fundamental view is we should not treat health care that someone who's well-to-do has more options than someone who's less.
So you don't like the Hyde Amendment?
I don't.
Okay, let me ask you. Well, should it cover illegal immigrants?
No, the
should
law.
It? I mean, under your goals, would it?
Under my goals, they're getting paid for now.
So you'd support covering them?
No, I think that the whole paradigm has to be we should cover people that are getting hospital care in emergency rooms in a more efficient way. I want to fix the immigration laws, but none of the laws, none of the bills that are being contemplated are going to allow anyone to sign up. But I ask you this question. Someone who's undocumented walks into the Kings Highway, a hospital on Kings Highway, they're going to get care. We're going to wind up paying for it. So we might think we're doing something by saying don't cover them under the bill, but we're really not. We're going to wind up paying for them anyway.
You're an honest man. And It's good to hear you. You're scaring the hell out of people on the right, but that's what you do. You don't have to represent them. We have to talk to everybody on this show. Thank you, sir. Thank you so much for coming in during the recess. This is a working congressman, and it's August. Anthony Weiner, thank you. Up next, you were great on Joe this morning. Up next, tickling your funny bone. Healthcare is getting beat up on the late-night comedy. Wait till you see Jon Stewart. The power of satire. Wait till you hear it. Stewart, well, he's something. Wait till you see him. We're watching Hardball on MSNBC.
Investing takes perspective.